Monica Kretschmer, and I'm the founder and CEO of the Universal Women's Network and Woman of Inspiration Awards. This is the Woman of Inspiration podcast, where we have the opportunity to talk with the women who are making an impact locally, nationally, and globally. Now, these are the women that are ignoring the naysayers and trailblazing a path, inspiring others to take action and live their dreams. So today with me is our 2018 Woman of Inspiration, Jessica Tsang. She is the founder and director of Direct Health Solutions, just to make sure that I got that correct. And what a timely interview this is. Jessica, thank you for taking time this Saturday. And I want to tell everybody the date, because when this is aired and when this is watched or when this is heard, years from now, next week, next month, I want people to know that right now we're experiencing a pandemic, a global pandemic. This is Saturday, March the 23rd. 21st. Sorry, my apologies. And it was only on March the 11th, 10 days ago, that the World Health Organization announced that this was a global pandemic. And what has transpired in the last 10 days has been unbelievable. So we'll get into a little bit about that and sort of your role and what you play in that big piece right now as a healthcare professional. But what I'd like to start with is your story. And the reason why I wanted to start with your story is all of our women of inspiration, I believe everybody has a story. And now it's so important that people go deep. We're experiencing hardships, we're experiencing times of uncertainty, but I believe there is hope, and I believe by sharing the stories of women like yourself that have experienced hardship and then come out the other side, it will inspire them to believe and give them hope. So that's what we're doing today. So Jessica, I want to go back to, I know that I interviewed you a while ago. It wasn't for the Women of Inspiration podcast. It was for the awards. And you shared a story of a young girl. So maybe we'll start there.
So myself as a young girl, that's what you're talking about?
Yes.
Okay. So I grew up in a small town in Saskatchewan. And as you can tell, I'm Chinese. So I grew up in a small town where there were very few Chinese people. And as a result, I was often bullied at school. So that actually made school a really unsafe space for me. I actually, ended up in the hospital a few times just because of bullying on the playground. And so I was looking for a safe space for myself, and I was looking around, and one of the teachers actually offered an opportunity to assist some of the other children with special needs during recess. And I'm like, well, I don't want to be hanging out on the playground during recess. So yeah, this sounds like a good idea. So I was probably in grade 1 or 2 when I started doing this, and I would volunteer to assist the other kids with feeding. I'd push them around in their wheelchairs out in the playground. And that was my first opportunity at actually helping other people in need. And it just made me realize that, no matter what's going on in my life, there's a purpose for me. It was just really rewarding for me as an able-bodied person to say, yeah, I can actually help out. This area of my life is not doing so great. I don't have a lot of friends, but I'm able to actually help out in this area. And it was really meaningful for me. And so as a result, that actually just kind of instilled this feeling of wanting to help other people. And it's really fulfilling, it's really rewarding, and it just made sense for me to actually choose the career that I chose, considering where I came from.
So I want to go back a little bit more. I mean, parents have kids right now, and, there are tools and resources out there for kids for bullying. God forbid there's any of that crap going on right now. It makes me sick. There's only space for kindness right now in everybody, right? But, when the dust settles and people go back to their own realities, after this hiccup that we're experiencing, and I say hiccup lightly, but, people are going to have to go back to, lifestyles and a new normal. And, that may where people are going to be put into situations where it's not the best economic environment for them. There might be depression, and I hope that people end up pulling together instead of pulling apart during this time. I really do. What tips can you offer to people that have young kids right now that might have experienced bullying, or how to help them navigate through this tough time?
At this point, I would really encourage, if everyone's homeschooling their children right now, but areas to focus on, not instead of simply just focusing on spelling and reading and math. Those are all really important things. The other things that are really important is actually empathy and compassion for others. Especially right now, there's a lot of negativity going around on social media and just in general. It's quite a negative environment out there. But just focusing on finding silver linings, gratitude. And if we can instill gratitude and compassion and empathy towards others, I think that will actually help build a stronger community. It'll actually help build a lot of strength in our children. Yeah.
Well, that's great advice. Empathy and compassion. We have so many other tools like Google and the homeschooling and the e-learning that we have on board. But I know in my own home, as soon as my son gets done that, he's like, okay, move on. What else can we do? So there's like, podcasts, and there's really great videos that they can watch that are inspiring stories, which is why we're doing what we're doing. Another thing I want to touch on, Jessica, is I know that we were talking in the green room, and I said I really want to put the emphasis on the toolkit that we can provide people to get through the chaos and the adversity. And so you described your story as a young girl and having that teacher, that one person back then that believed in you and that carried you through. So how did that one person become? Was there another person in your life? Was there another situation? How did that continue forward?
Well, there's been quite a lot of situations, and when it comes down to it, I think that it's up to us to be able to see opportunities and to be able to find opportunities everywhere, and there's positive people everywhere. Sometimes it's hard to see the opportunities when we're clouded with whatever's going on right now. But at this point, just look for opportunities. How can I help someone else? Where can I help? How can my family help someone else? And this is something that is definitely going to help us come together as a community more, is just finding those opportunities of how you can assist other people. Saying that, obviously at this point, we are supposed to be, we're supposed to be social distancing to avoid infecting one another, which is fair, but this is your opportunity to actually be dynamic, invent something, figure something out. Like, we don't always have to think inside the box. In fact, we're all kind of living in our own little boxes right now. So this is our time to be creative. How can we build a community when we're all in our own homes? Is there a way that we can actually connect with another person that's not just on social media? Or even if you are using social media, how can we use that for the better? Instead of spreading negative things, is there a way for us to share something positive and create positivity in this time right now?
And I myself have been looking at everything. I mean, one thing I'm blessed with is that we have a community. I've built a platform. I've been building it for 6 years, and it's online. And because of online events and all this sort of because of live events and all of these other things, people undervalue the power of what we have built. And honestly, everybody has a website. Everybody has, but there's no live events. You can't go connect with everybody. So what do you do? And I'm like, so I'm going full force to build out our platform because it's global and connecting with people and being out of the box. So I'm really excited about what I'm doing because people are, I've got a platform. It's just like, yay. I'm actually looking at that as a huge vehicle for people to continue to do business and to connect and have relationships and share exciting stories and celebrations, and I think that that's what we need to move and get our mindset into, is utilize the tools that are available. Mentorship's really key as well. Reach out for mentorship and coaching, mentorship, You know, and there's so many things, like you say, about helping and serving others that just is that's good for your mind, body, and soul.
Yes.
Like
And
it's a magic fix. Like I know I had a couple interviews the day before, and they're like, Monica, I don't know. I had to pull myself together for the interview. Right now we're in this global crisis. But as soon as we got into the interview, it was like this lightness that came up because this connection thing happened. And then we got talking about how we can get through it together. So I would love to know, I mean, mental health, you're in the healthcare industry right now. Mental health is going to be super, super important. How do people actually get through that?
so in terms of mental health, there's so many layers to this, and it's not an easy answer. I mean, in terms of one of the biggest things and the biggest issues when it comes to actually having a strong immune system and staying healthy is stress. Stress is actually the number one cause of the majority of health problems, disease, and obviously mental health concerns. And so when we're actually, stuck in our own homes, if we're festering this negativity in our mind, that will come out in one form or another, whether you get sick easier, it actually leads to high blood pressure problems, heart problems, just you name it. So again, it's like we got to focus on what can we pull out of this. Another thing that we've actually found, this is like over the years, of people without purpose, they are the ones who often end up in maybe negative spaces, mind and body. And so when people are no longer working anymore, or unfortunately, a lot of people have actually lost their jobs. Students are out of school, or some students are actually online now. So a lot of people are kind of feeling aimless and purposeless. And this is the time where it's like, maybe it's that moment where you can, get off the, what is it called? Like, the hamster wheel where we're always.
Oh, yeah. I feel like I'm on that thing a lot, just saying.
Yes. So we're constant. That's what we are doing all the time for our day-to-day lives. And then all of a sudden this has happened, and it's putting a halt to that. And it's saying, hey, slow down. Like, maybe this is the time for us to actually evaluate our lives. This is the time for us to do a bit of personal development, do some reflection, and consider, is my path leading to where I want to go? I mean, we would all hope and pray that eventually the pandemic it'll eventually resolve, and hopefully life will go back to normal, whatever normal is. But I would hope that if we could actually spend this time where we're in social isolation, we could actually spend this time to do some personal development. Look at your strengths and your weaknesses and try to figure out, well, how can I actually improve myself in this area? We do this every year on, December 31st and January 1st. And then by February, March, we've already forgotten what our goals are. Well, yes, this is a really negative situation, but why not turn something positive out of it? Find your purpose, find your reasons for being, look at your goals and think, are my goals aligned with what I actually want? And try to figure out how you can actually develop yourself over the next 2-3 weeks. There's tons of free online courses right now. Actually, there's a lot of free online courses that have started a while ago. Now people are discovering them. And now there's actually more courses available. This is where you can find virtual mentors. This is when you can actually spend the time. I'm hoping maybe an hour a day, that hour a day that maybe you used to spend commuting to and from work or school. Like, now you can actually spend that time to perhaps meditate, reflect, think about yourself, think about your values, spend another hour of the day actually connecting with people that you love and care about. People make all these jokes of like, oh yes, I never really realize that my spouse's favorite color was yellow. How did I not know that? I've been married to this person for a number of years. I'm like, well, we're not spending enough time connecting. So connect with the people who live in your homes. And if you do live by yourself, connect with those you care about. Pick up the phone and call them, have a video chat. So social isolation and having a lost sense of purpose can lead to mental health concerns, but how we can overcome that is just finding different ways to connect with other people, finding a purpose, and that will hopefully let you become stronger in the end.
And I think it's really important too, that as much as we want to say, let's connect, how about take this time to do some social disconnection, right?
Yes.
I think that's so important. I had met a woman in at Sundance this year, and she works with people on just like saying, okay, so we're going to check in your cell phone, and I have all your important emergency numbers, and I just want you to go and do a retreat of self inner reflection without your electronics. Like the sun shining, the sky is blue. When we don't see anything negative, we don't internalize it. So if we can remove ourselves, even for short periods of time, away from what's going on right now, it doesn't mean that we are forgetting about it or that we're ignorant about it. But I think that for our own mental well-being, we have to do that. And, you know, so take those times, and I exercise, exercise, get your sleep.
Yes.
Drink water. I know that I have my great big glass of water with lemon, fresh lemon in it. You know, every day, a great big lemon squeezed into my water, and I drink water all day long. So, you know, I think those are little things that don't cost a thing. But if we can get to that habit over the next 3 weeks, we're going to turn out to be the most incredible, healthy people by the time, you know, we can start, you know, getting life back to some sort of normal hum, you know. So I'm with you on this. This is a time for disruption, and I'm so happy to be surrounded by people that really want to move forward, that you know that you get through that. And I think that that mindset happens because you've been through adversity.
Absolutely. And like, you know what? This is the time where everyone gets to go through adversity. Yes, adversity, when you're in it, it is stressful. But this is the opportunity for you to build character. This is the opportunity for you to actually see the strength that you have in yourself and in the ones that you care about. Like, adversity is what makes people stronger. And that's why it's so important. So absolutely. So all those things on your list that in the past, let's say back in February, you were like, yeah, I don't have time to do that. That would be nice, but I don't have time. Like, now is the time to do it. Do it now.
Yeah. And, you know, I don't see it as a vacation time. There's lots of people that are like, I have all the time in the world on my hands. I'm like, really? You have all the time in the world in your hands? I don't know about you, Jessica, but I've got 10-hour, 11, 12-hour days, and I'm working in overdrive right now. Now is the time to work hard, right?
Okay.
I get super pumped by this because it's a time of creative disruption. And so I encourage people, take some time to rest, but don't take that foot entirely off the gas pedal, right?
Yeah, I'm not, rest is okay, but I'm like, no, now's the time for you to be reflecting and building your strength and doing personal development. This is the time to do it. It's not supposed to be vacation. This is the time for you to get to know your family members. This is when you actually go and have sit down meals with your loved ones and learn about each other. This is when you can actually pull up, I think my husband and I did this when we first met, is there's a list of 21 questions that the New York Times came out with to get to know your partner. Good Lord, I can't remember. This is like several years ago, but these are the list of questions that you can actually sit down and ask your partner these questions to get to know them. And they're questions that you don't really spend enough time talking to other human beings about these things, about, you know, asking what their personal strengths are, learning about their childhoods. I've met people who've been married for 20 years and they still don't actually know, you know, all about their loved ones' childhoods. Like, this is when you can actually spend time learning about your children and learning what their strengths are, learning what their challenges are. And this is just time for you to actually meditate and build your own self up.
Foundation, rebuild your foundation, your personal foundation. That's as easy as it is.
Yeah, it is.
And don't get stressed if you don't know your purpose or you're feeling stressed about this. Put it away. I'm going to share with you, I don't know if I've shared this with you before, but every time before I go to bed, I always ask a question. Tell me what I need to know, and then ask a question, and then I wake up and the answer is there. And I've just really trained myself to go to bed with a question because I don't want to spend my whole night worrying about it. and the answer always appears. And just open up your eyes, write it down. Even if it doesn't make sense to you, look at it later. But I swear, when you start getting into routine like that, where you're like asking these big questions, what is my purpose? What am I here for? You know, what is fulfilling to me? And then just leave it.
Yes.
Go to bed. Go have a good night's sleep. The universe manifests all these different things, and those answers come to you. So don't be all stressed out about it. Take it all in stride. Surround yourself with some great people. Listen to some great material from some really great people that have, you know, walked the path and that are, you know, inspiring. And they've been through adversity. This is just another bump in the road. It's a big bump, but not a bump that we can't get through. And like you said, we are all going through it together. And that is the big thing people need to remember, yes. Right? Is that we're all together right now.
Definitely. So it's just pulling on that and circling back to mental health. Unfortunately, I see a lot of people on their phones right before they go to bed looking about something negative. And the first thing they do when they wake up in the morning is look up updates about something negative. But why not? So the problem with that is that actually is going to cause more stress and more negativity in your own mindset, and that can cause more mental health concerns. So before you go to bed, at least an hour before you go to bed, this is self-care by putting your phone away, putting the negative things away, and putting yourself in a mindset that is asking yourself a question, putting something positive in your mind, putting something like, well, what do I want to work on tomorrow? What is something positive you can focus on, so that when you go to bed, your mind can think about that positive thing. And the first thing in the morning, you can ask yourself something like, what am I grateful for today? Starting your day with positivity and ending your day with positivity is actually going to change your mindset overall and will help protect your mental health.
And I'm going to add on one extra layer. I think that time management, correct, right?
Yeah.
Do your to-do list the day before. So when you wake up, you don't have to figure out what you're going to do. That is all written down. And I do that religiously. I've got lists going on the day. I check them off. I make a list before I go to bed, actually well before I go to bed for the next day. And I'm already on task for what I need to do, so I don't need to stress about it, right? Yeah. So, you know, all of these things that we can, if we haven't implemented something like that, something that works for you, I think you need to, and you need to look at the habits of the highly successful people. They don't stop and press pause during moments of crisis. They ramp up. They have a process in place for time management. They look at inventions. They look at being creative and disruptive. And they're fueled by this all. I mean, this is a challenge for them. This is, how are we going to get through this big, beautiful mess? And, you know, it is a big, beautiful mess that we're in together. But if you have that mindset, gosh, we are so unstoppable as a community. And, you know, we're an unstoppable force. We've got some beautiful, powerful people with some incredible intellect that we just need to pull together and keep pushing forward.
Definitely. I mean, as a business owner, now is actually the time for us to be looking through our inefficiencies and make our systems more efficient in the long run. So right now, yes, I'm pretty sure all small businesses are actually stressing out right now, but now is the time where you can actually look and evaluate everything and think, well, was this always necessary? Is there a way for me to make this protocol more efficient? Because now is the time where you actually have hopefully a little bit more time to be able to do that. But in the long run, it might be able to save us a bit more money. It might be able to, who knows? This is the time where we can actually we can get off this little hamster wheel that we're always on and take a look around and wonder, well, how can I make my business run more efficiently? A lot of people actually are going online now, which sometimes it's actually a good thing, right? So there's different opportunities that are available for us right now if we actually just take a look around and say, well, is there a way for me to continue doing business right now? Is there a way that I can actually maybe alter how I approach my clients and change it considering this, this current circumstances? And is there a way for me to take this and actually continue doing it because maybe it is more efficient? Maybe it is more efficient to have more virtual consultations, to have, meetings for your staff on the web instead of having to all trek in. This might actually be, we can actually make this into a positive thing in the end. It's possible.
Oh, I am right with you. I've had the most amazing meeting on Friday, an hour and a half, 7 o'clock in the morning. And I'll talk about it soon, but I'm working on something right now that is just so exciting. It's big. It's big, big, big. And it really, yeah, so super excited. That is the way it's going, and offering opportunities. Not only do you have to be, you don't have to be in your own city. Like I just, I think last year I started thinking about that and going, no, we need to be really promoting that. We have a platform that is virtual and there's no borders. I have people reach out to me from the UK, and I'm like, absolutely, of course you can, sign up for the mentorship program. Of course you can. You can sign up for these events, and those contacts and building the circle of influence is so, so important, right? Your business. I before we got off on a little bit of a tangent here, so I want to pull us back because what I really would love people to know is the story how the young girl that was bullied as a child has grown into this amazing, powerful source that is disrupting the healthcare system right now. And you won the award for 2018 Woman of Inspiration Millennial Leader. And, tell us about why you started your business, Jessica.
Thanks. So I have it's a private medical company. And we offer private medical house calls. So how this started was, so ever since I was a young girl, my grandmother's always told me how important it was for her to be able to stay at home. She feared moving into a senior facility, and that was something she's always instilled in us. Unfortunately, so she lived in her own little house. Unfortunately, as she became older, she started having trouble walking. And then she started having trouble with her memory as she started developing Alzheimer's. So saying that, it became harder and harder for her to be able to get out of the house. It became harder for her to go to the medical clinic. Eventually, she actually just flat out refused to go out of the house to go to her doctor's office, which made it impossible to A, actually get her diagnosed appropriately, and B, be able to get her prescriptions renewed. So, it was just such a big barrier for my family, especially my father, to be able to overcome these barriers, because we're like, well, we still want to honor her wishes. We want her to be able to live at home, but we need her prescriptions renewed. Like, these are kind of important prescriptions for her to be able to survive on. She's had them for decades. So we called around everywhere, and no one was able to refill her prescriptions because she wasn't able to leave the house. So, they're like, we called everyone and they said, well, just call EMS, and then EMS will take her to the emergency department, and then maybe you can get her prescriptions refilled there. Okay. So, we tried that, but having two uniformed men with a stretcher show up at her house, and my grandmother didn't speak English. So let's just say it just made her very agitated, and they gave us a choice to sedate her or to just leave her alone in her house. And we didn't think it was appropriate to sedate my grandmother to bring her to the emergency department to hope that someone would renew her prescriptions for a year. So unfortunately, because she ran out of medications, she just had health problems as a result. So going through that, and I was a nurse at the time, and I was running a home care company at the time. And I'm like, you know what? My grandmother is not the only it's not the only person going through this, because a lot of other clients that I've had have very similar situations. So I'm like, well, I wish someone did house calls. And nobody was doing that. And so I figured, well, I'm going to go back to school, and that's what I'm going to do. So I became a nurse practitioner, which gives us the ability to basically renew prescriptions, diagnose people, and whatnot. Yes.
So I want you to go back to, because there's a lot of misconception about like nursing. Like, you've got enough, your education is like, how many years is a doctor versus a practitioner? Like, you are, explain to those that are unsure of the difference between a nurse and a nurse practitioner, because there's a huge difference. And that is what enables you to do house calls as a nurse practitioner.
Yes. So I think when people hear nurse, there's three types. So there's an LPN, which is a 18-month to 3-year program to get a college diploma. Then there's a registered nurse, which is a degree, 4-year bachelor's degree program to actually qualify. And then after you're a registered nurse, then you can get your master's degree, and it's a postmaster's diploma to become a nurse practitioner. And that trains us to be able to there's different areas where we can actually specialize in. So I chose to specialize in all ages family practice, which means that we have the ability to become someone's family practitioner. So we can diagnose any types of ailments, manage chronic diseases, prescribe, diagnose. I already said that, but refer to specialists and all that. So unfortunately, as a nurse practitioner, although we can do pretty much most things that family physicians can do, we are not allowed to bill Alberta Health or any provincial healthcare. So as such, I was like, well, we have a bunch of really qualified people who are able to manage health issues. And we have a community where there's a bunch of people who can't leave their homes. They need medical care and they don't want to just move into a facility. So how can I connect these two? So that's how I created the company, is that we're just trying to fill a need in the community, and we're also just trying to create jobs for really passionate nurse practitioners who went over and above to get education, and I wanted them to make sure that they could actually build their own practice. So does that sum it up?
That sums it up perfectly. And I think that, this is a perfect example how your big vision has really helped out, because right now our medical everybody in the front lines and in our healthcare system, they are doing such an amazing job. And just to shout out, I'm getting goosebumps because they're in the situation, dealing with the treatments, dealing with the patients, and so they're being the brave souls out there doing what they love to do to help and serve people. So a great big shout out to every healthcare professional out there during this time of global pandemic, because you have so many supporters behind you. So thank you. What you have enabled is more people to help more people, Jessica, during this time. So maybe that's a great segue into what you're doing during this COVID-19.
Thank you. So because we're trying to prevent the spread of this virus, we're actually doing a lot more phone consultations, and this week we've launched virtual consultations, and we're offering it actually at 50% off, just because we want to be able to provide more access for people in the community. So HealthLink, which is our local free telephone line to actually get medical opinions from registered nurses, they've been overwhelmed. And so we've been actually getting multiple calls from people in the community saying, we've been trying to call in, we don't know what to do because we actually can't get through, and the soonest appointment we can book is like a week out. I need to be able to talk to someone because I'm in quarantine and I don't know what to do. So we've been able to adapt this to the situation by offering phone consultations. So for example, someone earlier this week called, they are asthmatic, they've got a cough, they've been advised to quarantine themselves, but they ran out of their puffers. So what are they supposed to do? They're not allowed to go to the medical clinic. They don't feel comfortable going to the emergency department because they're not quite that sick, but they don't want to be exposing themselves to any potential viruses. So they were kind of stuck between a rock and a hard place, and we were able to be the solution for them, because we offered a phone consultation and we were able to prescribe their inhalers so that they could actually get a little bit of relief during this time. A lot of people are also having mental health concerns as they're self-isolating, possibly because of either symptoms or just because of immunocompromisation. And so we're also able to offer phone consultations for mental health. Mental health counseling is something that we've been offering as well. There are a select few people we actually will still be doing house calls for. So earlier this week, we had an elderly woman. She actually lives in a seniors home. So pretty much all seniors home that I'm aware of have actually refused visitors to reduce the spread of infection into the facility, except for medical folks. So we're actually still allowed in. And for this situation, she woke up one morning and she was feeling awful. She actually couldn't hear and she didn't know what to do. Her family members couldn't contact her because she couldn't hear and she couldn't answer the phone. So the person tried to actually visit her in the building, but she was turned away at the door because visitors aren't allowed. So she actually phoned me. This is actually a previous client. So the family member phoned me and they're like, I don't know what to do. My grandmother can't hear anything. Can you please go over there and just see how she's doing and how she's okay, if she's okay. So we actually scheduled an appointment same day. I went up there. I was allowed in the building and I visited her. And we fixed the problem, thank goodness. So she was able to hear again. And, you know, I actually just sat and hung out with her for a little while and shared pictures of my daughter with her, which she's actually met in person several months ago. And so we were able to, see her resolve her health issue. And it was also a bit of a socialization visit that she desperately needed. Like when I showed up, she was in tears because she didn't know what to do. She felt trapped. She couldn't get visitors and she was just crying because she thought she has trouble seeing and her only thing that she had left was hearing in one ear. She's like, no, this is something I need. So I was really grateful that I was able to actually resolve that issue and just build in a bit of time to just give her a smile and have a conversation with her. So that's something that we're also able to do is we still will do in-person visits as long as you are not considered contagious or high risk. I also wore a mask just in case I'm a carrier for it. So we're doing our best to try to protect our elderly clients and anyone who has a compromised immune system by trying not to see them in person. But if we have to, I'm still going to wear all the equipment that I need to prevent the spread.
So I'm going to ask you, what are some of the common things that, you know, if you have a runny nose, asking for a friend, if you have a runny nose,
okay.
You feel pretty good, but, you know, you might have a slight headache, you know, and I think it's from stress or lack of sleep or lack of water, but you're the nurse, so you tell me. So, you know, people are, you know, they're going to be low on hydration, low on sleep, even though they try and get it. We're in cold season right now. So what is the difference and what are the real red flags for people to watch out for?
At this point, so it is actually cold and flu season. A lot of the swabs that we've been doing have actually been coming back for cold viruses and influenza viruses, not COVID. Saying that the symptoms can range from no symptoms to mild symptoms to severe symptoms, but at the same time, whatever you have, you should be self-isolating. So if you have a cold, a runny nose, a cough, you know, something that is potentially contagious, please wash your hands and please just stay away from other people. I think that's something that we should have been doing a long time ago and we should continue to do it now. But especially now, we're just going to take extra precautions just to reduce the spread of COVID. So if you do have mild symptoms, one of the most frequent questions I have is like, oh, well, I've got a runny nose. Should I go get testing for COVID? One of the issues right now is that there's actually a shortage of swabs. So I was actually looking online and each province has a maximum capacity of how many swabs they can test per day. So for someone who has very mild symptoms that may or may not be even relevant to COVID, for them to request a swab is potentially taking a swab away from someone who actually needs it. So at this point, am I recommending that everyone get swabbed? Not at all. If you're in healthcare or you're in the food industry, or maybe if you work at the grocery store and you have mild symptoms and you're still going to work, that is a very different scenario. But if you're able to be at home, like self-isolate, please just do so, and please try to avoid going out of the house. I see a lot of really generous people who are donating their food products and hygiene products and whatnot to other people that maybe they don't even know. It's on the internet, and I'm like, that's so nice. However, if you are self-isolating because you're under quarantine, if you potentially have symptoms, those things that you're donating to other people could actually carry the infection to other people. So I would just be very cautious with that. But in general, if you have very mild symptoms, it's the same type of care that you would provide to yourself otherwise. Drink lots of fluids, rest. Tylenol if you need to. We don't fully recommend Tylenol just for like everybody overall, but if you are symptomatic, you're uncomfortable, or maybe if your kids are uncomfortable and it's not contraindicated to take a bit of Tylenol, then feel free to do so, to especially at nighttime, just to help yourself get a better night's sleep. And that's the type of self-care that you would need to do. If you are having difficulty breathing, that is a very different story. If you're having difficulty breathing, then it's probably a good idea for you to proceed to an urgent care or emergency department. When you show up,
call first.
Call first so that they can prepare for you, because you will need to wear a mask once you show up to avoid spreading it to other people in the waiting rooms. But unless you are concerned and that you need treatment ASAP, then there's other things that you could do. So HealthLink is always an option if you live in Alberta. Otherwise, there are a lot of other healthcare practitioners who are going online. So myself, I'm going online, so that we're offering virtual consultations or phone consultations. And that way you can at least get a medical opinion of, should I go to Emerge, or what should I do? How do I manage my current symptoms? When should I be concerned? And that's actually the huge influx of calls that we're getting, are people trying to figure out, how sick is my child? When should I bring my child in? Do I need to bring my child in? Should my child be near my grandmother? Or, well, yeah, yes. So the red flag symptoms are, it's difficulty breathing, and that's when we definitely want to get them assessed. But until then, if you just have mild symptoms, stay put, hang out, drink lots of fluids, rest.
That is great advice. And I actually am so happy that you paved that road, because it's been super helpful. What you're doing and what your company is doing is, you've just proven your model over and over again. So I am super excited for, what's going to happen to enable you to help more people after we get through this, and actually being able to help people during the process as well. But Jessica, I know that you're a new mom. I want to say, enjoy this time with your little one. You're out there. She's not even a year old, and you're out there working like a true entrepreneur. It's I think that you were out the door, and I think you were breastfeeding while you were on your computer and going, Monica, are you the only one that understands this? And I'm like, no, there's more of us that understand this. So if it feels good, do it, right? So I commend you on balancing this all together, and still giving so much back to the community, and still having your family life that you're keeping really close to you as well. So kudos to you. You're an inspiration, of course. I look forward to continuing the conversation with you. But before I do, I know that we talk about men, and you have an amazing support her and your system, and you married one. So how important is it for those watching to really, recognize the men that are champions for women?
Oh my gosh, it's so important. So I have a 5.5-month-old. So I feel a lot of relief knowing that I can count on him to actually watch her, especially when I'm doing things like this. I have done a lot of video conferencing with my baby, bouncing her up and down while I'm having a conversation, but I'm actually really thankful that I don't have to do that at this current moment. So he's been really supportive. Emotionally, it's been nice to be able to actually have conversations with him about the stress that's currently going on, because he's also a small business owner. And just as a parent, it's so nice for us to be able to rely on each other. He actually cooks most of the time right now. I think he's cleaning this morning. So it's been so lovely. And like my father, for example, I've been actually asking my parents for a bit of help, especially in terms of childcare. So my dad's been driving my mom around. And you know what? It's a lot of people's relationships are changing a little bit depending on what's going on. But in this current situation, we do need to rely on each other. He has a small business, I have a small business, and we're stressed in very different ways. And then we're also adding on the 5.5-month-old and our dog. So I do have wonderful support hers in my life, and definitely my husband is the best support her. And yeah, he's been great. He feeds me. He's cleaning the house. He's taking care of the baby right now. Yeah, I'm very grateful.
So I think a good shout out to all the men that are supporting the women through this time, and and the leaders in the community. I know that Woman of Inspiration is moving forward this year. I am lifting up every stone to make that happen. We canceled our summits for May, of course, but we're building a 2-day event in Calgary and Toronto this year, and nominations are still open across Canada. I have a feeling that our awards this year will be more meaningful, and will reach a larger group of people, and the people that are being recognized, because there's certainly some unsung heroes in the crowd that will need acknowledgement, and it'd be really lovely to be able to do that in September. So I look forward to hearing great more things, and perhaps that we can jump online again. I wish you all the success in the world. Thank you so much for all your time this morning. And yeah, I hope that everybody watching and listening had so much information. Jessica, how can everybody get a hold of you?
So if you can always feel free to phone our office. Our number is 403-973-3188. Otherwise, you can visit our website. It's directhealthcanada.ca.
Okay, I'm going to direct everybody to the website. I'll put that link into the comments of the interview as well. And just a reminder to those that are thinking, and this is the timely one. This is for the people that are looking at the healthcare system for the swabbing and stuff like that. Please look for the advice out there. Don't go in unless you're really sick. Don't hoard. Stay home. Use this time for good. And
Stay away
really
from negative social media.
no negative social media. It's got to be kind, or don't do it. And take some time to rest and find what's truly meaningful.